Hi, and welcome. My name is Nancy Stevenson, and I am a product development scientist for Nestle Health Science located in Bridgewater, New Jersey, USA. Today, I will be discussing the extraordinary development of Meritine Clinical Extra Protein. First, I would like to show you a video introducing our Nestle Health Science Global Product and Technology Development Center to you. In this video, you will be introduced to our center, to our different groups and functions, and most importantly, you will see our wide range of capabilities here at Bridgewater. I hope you enjoy. The capabilities and expertise within Nestle's global product and technology development allowed us to overcome the technical challenge in Meritine Clinical Extra Protein. Meritine Clinical Extra Protein was challenging to develop due to its very high protein content, as well as a high calorie content. However, overcoming these challenges were worth it due to the overwhelming benefit of high protein, high calorie beverages for our patients. Based on patient-centric insights, we know that our patients have difficulty drinking large volumes and they get fatigued during drinking and eating. Therefore, offering a product with the most nutrition possible in a small volume is a great benefit for our patients. On the other hand, high protein and high calorie beverages are challenging to develop for a variety of reasons. High protein and high calorie products can be difficult to formulate in a consistent and logical way. It can be strenuous to manufacture due to higher concentrations of protein and nutrients in the product stream. And lastly, it can be challenging to develop a clean and great tasting product at such high nutritional concentrations. And although there are many challenges to overcome, we stayed persistent in finding a solution for our patients because we know that there's a convincing benefit for them. With Meritine Clinical Extra Protein, we are able to deliver a product at the highest concentration of intact milk protein in the world at 16 grams of protein per 100 ml. We also have a clean, balanced, and great tasting product. And the development of this product is thanks to a variety of experts in Nestle, including protein, sensory, product development, manufacturing experts, and many, many more who made this possible. So now I'm going to discuss some details regarding our development process at the Nestle Product and Technology Development Center and the process we use to develop Meritine Clinical Extra Protein. You will notice 3 different scales in size: lab, bench, and pilot plant scale. So I'm going to walk you through the different evaluations we perform on each scale and how we successfully scale up to the factory, which is 12,000 liters per batch. First, on the lab scale, we select our key ingredients by performing lab scale experiments or testing. And the lab scale can be anywhere from 15 milliliters in size to 2 liters in size per trial. And one of the main things we do on the lab scale is we carefully select our protein sources and levels. We can do different types of testing on the lab scale. So we can look at how the proteins mix with water and other ingredients. We can also predict how the proteins will react in the manufacturing line by exposing the protein mixture to high levels of heat and checking for a reaction. And we also evaluate other key ingredients at this scale, such as a carbohydrate source. And we can evaluate taste, the texture, functionality of these ingredients on the lab scale before we move to the bench scale. So once some evaluations are done on the lab scale, we move to the bench scale, which operates around 20 liters in size per trial. The bench scale is a very small version of the factory line and is used to screen recipes during development. First, we validate the selection of our key ingredients identified on the lab scale. We may also predict whether or not these ingredients can be manufactured on a pilot plant or factory scale, but understanding first how they perform on the bench scale. Also on the bench scale, we do full base recipe development, which includes all of the macronutrients, protein, fat, carbohydrates. And we fill all of these trials into bottles, which are stored in a variety of temperature chambers throughout shelf life. And the filled product is evaluated immediately after filling and observed over shelf life. And the top recipes are then scaled up to the pilot plant scale for further improvements and validations. So once we develop the base recipe, we then move to the pilot plant scale, which is anywhere from 300 to 2,000 liters per batch. And at the pilot plant level, we fully develop the recipe, which includes macronutrients, micronutrients, flavor, and color. I would also add that many flavors are screened during the development process in order to select the top performing flavors. So also in this stage, we develop and optimize the manufacturing process that will eventually be scaled up to factory scale. We optimize the manufacturing temperatures, homogenization pressures applied to the product, pH, and many more parameters. And similar to the bench scale, all pilot plant trials are filled into bottles that are evaluated immediately after producing and also observed over shelf life. And pilot plant trials are compared to each other, and top recipe and manufacturing processes are selected. And we continue to improve and optimize the product characteristics based on a combination of recipe and manufacturing process improvements. And at the end of development, the final recipes and manufacturing process is scaled up from pilot plant scale to factory scale, that is again around 12,000 liters per batch. And with all trials and products, we make sure that the recipe and process fully align with all of Nestle's quality standards. And if there's any questions on ingredient types or levels, we can always move back down in scale to pilot, bench, or lab scale to answer our questions. So in parallel to optimizing the recipe and manufacturing process, we emphasize flavor and sensory work during development. First, we perform flavor screening to select the most promising flavors to be brought forward. We perform both informal and formal sensory evaluations of flavors at bench and pilot plant scales. And the top options are typically brought from bench scale to pilot plant scale and further optimized to make a great tasting product. And once we select our preferred flavor options on the pilot plant scale, we then use our trained sensory descriptive panel at Bridgewater to perform product sensory profiling. So we can evaluate and quantify the aromatics and off notes in the recipes. We can benchmark our pilot plant prototypes against other products and perform product profile mapping, which you can see an example here in the scatter plot. And then we then repeat all this sensory testing as often as we need, and we perform iterative optimization work. And finally, we take our best option forward to factory scale to deliver breakthrough innovation. In Meriting Clinical Extra Protein, we are launching vanilla, strawberry, and coffee flavors with more to come. And overall, our product is exceptionally clean in taste at such a high protein level, and this we are very proud of. So this concludes the discussion around the development process of Meritine Clinical Extra Protein. Thank you so much for listening to me today, and I hope you enjoy your remaining presentations. Thank you.